Hello, everybody. This is Mynor with Asset Legacy Planning.
And Francine Walters with Walters Asset Protection and Mortgage. So, Minor, I had a question for you. You said that you and your wife recently went to a conference and there was new health information that you learned about. And you said something about MIPS, and I didn't quite catch all of that. Can you give me more information on it?
Sure can. So, what we're talking about is a concept of two entities. Like a joint commission and the MIPS measures, and I'll explain what MIP is. So, it's a merit-based incentive payment system. It sounds really interesting. That doesn't really say anything, but it's the program that would determine Medicare payment adjustments, and the facilities that run them will get they're going to use a composite performance score for eligible clinicians, right? ECs that may receive a payment bonus, or they're going to get a penalty or no adjustment at all. So what does this have to do with our consumers and our audience? Well, let me ask you this. The next time you go to a medical facility, you may be asked, do you have a medical directive, or do you have a power of attorney for medical? Now,
Actually already happened to us when I took my daughter to the hospital. They asked us. They
now
sure did.
that is critical. Now, here's the thing. It might sound like they're doing you a favor or they want to help you out, but why do you really think they're asking that?
Well, from what I've learned after the past couple of years, typically it has to do with money for them and really not to do with our health or our benefit, unfortunately.
Yeah, so if we run a scenario and someone who says, like, let's talk about the person that says no, let's talk about the person that says yes, right? Is the person that says no, are they protected?
I
They're
don't
not,
feel that they're protected.
right? The person that is protected, the person that says yes, here's kind of what would happen. So who should have one of these documents? So we're talking about the medical directive and the power of attorney for medical. And there's also another form. It's called the HIPAA waiver. So, Francine, you have children. I have children. The moment that they become 18 years old, as much as they are our babies, by law, and they go to the hospital, they are no longer our babies. They have their own jurisdiction, they have their own protections under the law. And so I'll give you a scenario. A kid goes to college, 18 years old. College students do college things, right? And
Okay.
so, maybe they're goofing around. He gets into some kind of an accident, goes to the hospital. Mom comes in, kid's 18 years old. The mom has no jurisdiction over that child as to their health, right? That
Right.
that is the reason why every 18-year-old, the moment that they become 18, should have these documents. And what that's going to allow them to do is it's going to allow the parent to be their health agent, or in other words, make health decisions for that individual, right? So now what does this have to do with MIPS? Well, if the person does not have these documents, it's a lot of favor for the registered clinicians, the people that are going to be getting these incentives, or they're going to be jeopardized. The eligible clinicians with the ECs would be the ones who are going to be benefiting from your child not having their documents in order.
So wait a minute. So you're telling me that then they get to make all of the medical decisions at that point?
That gives the facility the right to exercise whatever they see fit,
Mm.
and you have no voice in it. Okay, so to make this a little bit more clear, to make this a little bit more like believable, most people that, have been to my channel, they already know my story of how our family is overcoming the loss of our 25-year-old. Now, there was one little tweak that happened with us. My daughter, when she was in the hospital, she was still awake and aware, and she had all her faculties, right? So she personally gave consent verbally to that her mom and I could act in her her behalf. Now,
Oh, wow.
one of the hardest things, and this is a heart-wrenching story, because there came a point that the doctors called us and they said, you got to get here right away. We're losing her. And we rushed to the hospital. They literally, ran up to the ICU, and they told us, you need to sign a do not resuscitate order, or a DNR, right? And that was one of the most difficult decisions to be in, right? Like, this is your child, something terrible is happening, but there, the story, it's a story of redemption, and we believe in an eternal God. That, believe me, she's in a much better place than we are, and there's a beauty that's come out of this story, and we've been able to overcome. We're overcoming, but that's that connection that I'm telling you. If she had gone into a coma on her own, we would have lost the ability to do all of the things that we're able to do. And then one last thing that I wanted to discuss on this matter here. So think about what happens when somebody has a life insurance and it has a living benefit, right? So briefly explain living benefits of a life insurance, and then I'll tie in what I was trying to say.
Yes, so with living benefits, you get access to your death benefit while you're still alive. So you get an advance of it. So it's not like if you have a policy where you're building cash value that gets tapped into. No, that is still continuing to grow, but you get an advance of your death benefit to help you through that medical emergency.
And it could actually, we've seen examples where that advance has helped the individual, get better care, and then they come out of the situation, right? Here's one trigger though. If in the case like our daughter, and I'm being very vulnerable here, right? Because I want people to understand one thing that I learned over this trajectory is I'm not gonna waste our suffering. We're gonna tell our story so other people can benefit from it. So in this situation, my daughter was the owner of the policy and she was the insured. Two things. She had beneficiaries, but remember, she was the insured and the payor. So she was the only one who could exercise those living benefits, but she was in a coma. Now, how can you do that with a medical healthcare directive, power of attorney, with the HIPAA waiver, with all the documents in place? There you have it.
Wow.
That's how you solve that. I know we gave our audience a ton of stuff, and I think the only way that anyone's going to really, let this segment in their mind is by watching the video over again, asking the hard questions, and just follow us for our mini series on what we're doing with asset legacy planning and Walter's asset protection, because it's a combination.
Yes.
It's a 1-2 punch.
Yes, and Mynor, and the big takeaway for people from this is that if they've got life insurance, they must have these documents in place to protect their family and to protect themselves and their family, so their family's not agonizing, not able to access their living benefits and help them get better care. So tell everybody, Mynor, what documents do they need to have in place?
Yeah, I mean, for this particular one, we're talking about the power of attorney. As with asset legacy planning, that's one of the first documents, and then along with that, you have a healthcare directive that you describe exactly what you would want to happen to you in case you couldn't respond on your own, and also for parents, having a HIPAA waiver so that when that child goes to college and you're called and you're rushed to take care of them, you know exactly what to do, and you have the right to say what you want to say, because this is what you discuss. Have these conversations with your family ahead of time. It's like preparing for the worst, right? Let's not make it taboo anymore. Let's open up and have these conversations. Everybody is talking about mental health, like that used to be taboo. Well, we're opening up. People are talking about suicide prevention. Hey, let's open up the conversation. Why are we not talking about health, like protecting our health in a more profound way? Let's stop the taboo. Let's open up these conversations. Let's make it easy for the families to be protected.
Absolutely. And for life insurance agents out there, they must share this with their customers. I know because of you, I'm very aware of that because of the story you shared. And that's why that's such a big, important part. Once you deliver that life insurance policy, that you educate your customers and let them know this needs to be in place if you ever should need it. And every life insurance agent out there needs to be doing the same thing.
That's right. Well, hey guys, thanks for watching. This has been a part of our mini series, and we're just so delighted to be able to educate you and just bring you up, information that will make your life easier and better should something really happen. So keep watching for the next ones and look at the information in the description. Thanks, guys.
Thank you.